Okay. Knock knock. My name is Chizoba. I'm gonna be your nurse today. I sanitize my hands and provide privacy. Can you verify for me your name and date of birth, please?
Magdalene Faye, I was born 1977.
Name and date of birth matches patient's record. I'm here to perform head to toe assessment. I already reviewed your doctor's order, and we have the order to perform head to toe assessment. Before now, the PCT already gotten the vital signs and they are within normal range. And Selling chart is 20 out of 20. That means my patient can see very well. And do I have your permission to start?
Yes.
Do you have any allergies?
No.
On a scale of 0 to 10, how would you rate your pain?
0.
0 means no pains. Okay. And how are you feeling generally?
I feel good.
Okay, my patient is mood is good overall and she is well dressed for the weather. Do you know where you are?
The hospital.
Do you know what brings you here?
I'm here for my
Physical assessment. Do you know who the president of the United States is?
Donald Trump.
Okay, my patient is alert and oriented to time and season, and my patient is alert and oriented times 4 to place time, season, and situation. And I will go ahead to start. I'll begin by palpating your head. Do you give me the permission to touch your head?
Yes.
Okay. Do you feel any tenderness while I'm palpating your head?
No.
Okay. There are no infestation, no lice, no worms. Hair is evenly distributed, and then it's normal cephalic. Um, okay. I'm going to go ahead to inspect your ears. Okay. There are no discharge, no drainage. Can I see the other ear? No discharge, no drainage. I'm going to palpate both ears. Okay. Tell me if you feel any tenderness.
No.
No tenderness. I'm not feeling any masses, no bumps. And my patient says that she doesn't have any tenderness on the ear. I'm going to use my pen light to flash in your ear. Okay. No drainage, no discharge on my patient's ears. Okay, I'm going to go ahead to inspect your eyes. Okay, can you pull your eyelid down for me? The conjunctiva is pink and moist. Sclera is white. I will measure my patient's pupil. Okay. Pupils are equally rounded, and it's 3 GMM. I'm gonna go ahead to inspect your nose. Nose is in the midline, and then can you close one of the nose and breathe for me? And the other one. Nose is patent bilateral. Can you tilt your head back? I'm gonna shine my flashlight. There are no septal deviation. Mucosa is pink and moist. Looking at my patient's mouth, her mouth is pink and moist. Can you show me your teeth? There are no missing teeth. Can you open your mouth? Okay, I'm gonna use my tongue blade. Buccal mucosa is pink and moist. Can you put the head up? Palate is pink and moist. Uvula is in the midline, and the tonsils are not touching each other. Okay, can you go ahead and swallow for me? Okay, I'm checking my patient's trachea. Trachea is in the midline. I'm palpating. There are no masses. So swallow again for me. Okay, my patient can swallow. Okay, I'm gonna go ahead and check your lymph nodes. Okay, pre-auricle, post-auricle, tonsils, submandible, submental, anterior cervical, posterior cervical, supraclavicle, and deep clavicle occipital. and all lymph nodes are non-palpable, which is good. And I'm gonna go ahead and check your carotid pulse, okay? One at a time. Carotid pulse are 2 plus bilateral. Can you tilt your head to 45 degrees? I'm checking for JVD. There are no jugular vein distinction. And then I will go ahead to use the bell of my stethoscope to palpate the carotid pulse. No brute sound heard. Okay, so I'm gonna do my cranial nerve test now. Can you close your left ears for me? And I'm gonna whisper 3 words and you repeat back to me. Fine. Good. And the right ears. Well. Patient can hear on both ears 3 out of 3. Can you, and this is cranial nerve 8, can you smile, frown, puff your cheek, raise your eyebrows? Okay. Can you close your eyes? Tell me where you feel this pain.
Forehead. Left cheek.
Left cheek?
Right cheek.
Okay.
Chin.
Cranial nerves 5 and 7. Sensory and motor is intact. Okay. Now I'm going to palpate. Okay. I'm going to check your 6 cardinal field of gaze. Okay. And I will shine the pen light on your eyes. Okay. 1, 2, and then just follow my pen light. Okay. 1, 2, 3. 1, 2, and 3. Can you follow my pen light? Now bring it close to you. Okay. Patient's eyes are reactive to light and accommodation, and perla is intact. Okay. And then can you stick out your tongue for me? Can you roll your tongue sideways and the other one? Can you raise it up and down? When I put it, taking your guard, okay. Can you swallow? Okay. Cranial nerves 9, 10, and 12 is intact. Can you raise your shoulder and shrug it? Cranial nerves 11 is intact. Now I'm going to palpate my resident's thyroid gland. Thyroid gland is non-palpable. Okay, can you stretch your hands? I'm going to assess your skin. Looking at the skin, is even tone, color is even tone, appropriate to my patient ethnicity. Skin is intact. Okay, there are no lesion, no cuts. Skin is warm to touch. There are no clubbing on the fingers, and capillary refill on both fingers are less than 3 seconds, and skin toggle is intact. Okay, I'm gonna also do your range of motion while we are on the upper extremities. Can you stretch your hand? Can you wiggle? Cerebellum test is intact, and can you flex your fingers, your hands, and stretch it out? Okay, you're gonna push against my arm. Okay. Patient's range of motion on upper extremities are 5 out of 5 against resistance and gravity. Okay. Now I'm going to auscultate your lungs and heart sound. Okay. Can you lay down for me? Patient is not using any accessory muscles to breathe. Okay. Take a deep breath on my second. Any other right clavicle. This is where I'm going to assess apical pulse for 1 whole minute. And all hard sounds are clear in all auscultation. There are no brutes, there are no murmurs heard. Okay, I'm also going to go ahead and listen to my lung sound. Right upper lobe, left upper lobe, right middle lobe, left middle lobe, right lower lobe, left lower lobe. Lung sounds are clear in all auscultation. Can you sit up for me? I'm also going to listen to the posterior lung sound. Looking at my patient's back, there are no abnormalities, no lordosis, kyphosis, or scoliosis. I'm going to check your lung expansion. Breathe for me. Lung expansion is symmetrical, and then I'm going to listen to your lung. Right left upper lobe, left upper lobe, right upper lobe, left middle lobe, right middle lobe, left lower lobe, right lower lobe, left lower lobe, left lower lobe, right lower lobe. Lung sounds are clear in all auscultation. Thank you. Can you lay down? I'm going to assess your abdomen. Looking at my patient abdomen, it is flat. The contour of my patient abdomen is flat. There are no distension. When was your last DM?
Yesterday.
Yesterday, good. Do you have any difficulty going to the bathroom or painful urination? No. Okay. I'm going to auscultate. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, aortic, cranial, and iliac. And I had tympanic in all quadrants. There are no brutes. I'm going to focus. Perfect. Vowel sounds are normal in all quadrants. Can you sit up for me? I'm going to do a chin to heel test. Good. Good. On the lower extremities, can you stretch your legs out? Assessing the skin is even tone, appropriate for my patient ethnicity. There are no signs of edema. Capillary refill is under 3 seconds. And then I'm gonna, can you wiggle? Okay, can you flex it again? Okay, I need you to push against my hands, okay? Good. On my patient's lower extremities, range of motion is 5 out of 5 against resistance and gravity. I'm gonna go ahead and check on my pulses. Okay. Brachial pulse, 2 plus bilateral, radial pulse, 2 plus bilateral, dorsalis pedis, 2 plus bilateral, posterior tibialis, 2 plus bilateral, popliteal, 2 plus bilateral, in safety. Can you walk for me? Take like 6 to 8 steps. Come. Okay. Can you see? My patient has a steady gait. Romberg test is done. Okay. Do you have any question for me? Okay. Thank you for letting me care for you. I will record the findings and I'll let the doctor know. This is the end of my head-to-toe assessment. Thank you so much.
Thank you.